If something as simple as a blood test could help you find out you have cancer earlier, increasing your chances of survival, would you take it?
And we really see a future where annual screening for early detection of cancer is just part of your routine care. It happens at your annual physical, and we detect, today it's lung cancer, but we see the opportunity to detect other cancers. That's the future.
That's Susan Tousi, Chief Executive Officer of DELFI Diagnostics, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. You hear it time and again, early detection of cancer is key to a person's treatment and long-term survival. When it comes to lung cancer, which is the leading cause of cancer death, only 16% of cases are diagnosed at an early stage, according to the American Lung Association, and that does not bode well for long-term survival. OSF HealthCare, through the Breakthrough Treatment Center at the OSF Cancer Institute, is partnering with DELFI Diagnostics to help improve screening rates and hopefully diagnose lung cancer cases earlier, and thus getting the person the treatment they need sooner. Joining me today to discuss this exciting work are Susan Tousi, the Chief Executive Officer for DELFI Diagnostics, and Dr. Mark Meeker, the Vice President of Service Line Physician Services for OSF HealthCare, and himself an internal medicine specialist. Welcome to both of you. So before we get into the nuts and bolts of how this test works, and let's talk about your own backgrounds that drive your passion in this work. Susan, I'll start with you.
Oh, it's such a pleasure to be here. And, I come from a long line of medical doctors. And I think it skips a generation because I have now a son in medical school and one applying to medical school. Wow. But I went down a technology route. I was always fascinated by engineering and technology. And so for the last, 12 years, I was working on the core technology of sequencing. What brought me to DELFI was this was an application of that technology that was so inspiring. This ability to detect cancer early at in an affordable way, accessible way, at global scale, and that opportunity was just too big an impact to forego. And I am thrilled to be part of DELFI. I'm thrilled to be partnering with OSF in making this revolutionary change in cancer care, finding it early.
Yeah, absolutely. It's huge. It is the future, honestly.
Absolutely.
And Dr. Meeker, I know probably some of your own patients that you see regularly kind of drive your passion, because you understand the importance of early screening and what that can mean for someone, don't you?
Absolutely. I have over 35 years of patient care experience, so I've seen it all. People that don't get detected in time to have a cure and people that do. And obviously the outcomes are drastically different. And for full transparency, also, my mother died at age 63 of breast cancer. It became metastatic before it was detected. So I have a lot of passion around trying to find these cancers at a curable stage.
Okay, so are people hesitant to get screenings? Because you say the word screenings, and already your head goes, oh no, I'm afraid of what they're going to find. So do you see hesitancy getting screenings of any kind, and if so, why?
I'd say there's probably three buckets of people. There's a bucket of people that want every screening they can get, and they seek it out. And then there's probably an equal bucket that will get screened if it's recommended. And then there's probably a little bit smaller bucket, but maybe 20-25% of people who really just are hesitant. Mm-hmm. And the reasons to be hesitant are variable. Some it's cost, some it's access, some it's I'm afraid to know. So that varies across the board, and that's where shared decision making comes in, of really educating the patient about why we're doing this and the rationale behind it, et cetera.
Absolutely. Yeah, we care a lot about making screening accessible, and so when we thought about our test, we thought it should be as simple as a blood draw that you get for a cholesterol check every year. It should be part of your annual healthcare process, and it should be something that's done in the office before you leave, and you don't have to schedule in advance, and you don't have to wait an enormous amount of time for the result. So our test is basically one blood draw. It's as simple as that. And if the result is not elevated, then you're fine. You're 99.8% that you don't have cancer, which is as good as it gets pretty much in these diagnostic tests. And you can go and come back the next year and take the test. If your result is elevated, then you're 5.5 times more likely to find something in the next step, which would be a low-dose CT scan. And so at that point, you're really motivated. You should get that done. It takes a little bit more time to get that done, but you should absolutely get that done working with your healthcare provider. And so we just want to make it easy. And we really see a future where annual screening for early detection of cancer is just part of your routine care. It happens at your annual physical, and we detect, today it's lung cancer, but we see the opportunity to detect other cancers. Right. And maybe even like any early stage cancer that might be present in your system. That's the future. This is the start of the future. People don't have to die from cancer. People can find cancer early.
Dr. Meeker, do you think having those conversations, again, I'm coming in to get my cholesterol, blood count, whatever, all the normal stuff, is easier with a primary care provider as versus, because sometimes when you say, screening and a specialist, I think in people's minds, the thought process switches a little bit. Are those conversations easier coming from a primary care physician?
I think that's absolutely true. And the bottom line is screening is a primary care service. You don't get to the specialist until you have an issue. So screening is in the primary care realm. We've been recommending low-dose CTs for lung cancer screening for several years now. We're doing pretty well with it, but the thing that the liquid biopsy, the first look, gives us is another option and another tool in the toolkit. And it's so much easier because it is just a blood test. And so they're getting their blood drawn maybe for whatever monitoring they're doing anyway. So you just add the first look to it. It's the same blood draw, and you get that screening. Now, what that does, to Susan's point, is it puts you in a probability category. If the test is negative, you have a low probability of having a cancer. It's never zero, but it's very low. Yeah. If it's positive, that doesn't mean you have cancer, but it means you need to go to that next step. Which is a low-dose CT, to see if there's any evidence there of an abnormal nodule. And then if that's negative, then it's back to annual screening. But if it's positive, then there's steps you go after that.
So let's talk about the annual. So there could either be elevated, which puts you into that next, let's go get the low-dose lung CT just to see where we're at. But non-elevated doesn't mean, okay, I'm done, never see you again. It kind of needs to be regular. Yes. It seems like we've focused on our heart and all sorts of other things that we get regular blood draws and screenings for. We look at cholesterol, we look at all those other things, lipids, and all those things that thus non-medical type go, okay. So this falls into that realm, to keeping an eye on it.
For people with a certain risk category or a certain set of risk factors, annual screening is recommended. It's not annual screening of everybody that walks in the office, but it's annual screening for the people that meet certain risk factors.
Okay. Walk me through what those risk factors are. Who should be getting this test?
There's a number of risk factors: age, smoking history, some genetic findings if you have a genetic predisposition. Those are the main ones that we look at right now. And I think, and I'm sure Susan thinks so too, that as this technology progresses, we'll further refine those risk factors, especially on the genetic and the genomic side. That's early work. And it's just getting into our guidelines now. And I think this is going to change dramatically in the next 3 or 4 years, probably.
Absolutely. Yeah. We're working hard on making sure it's part of guidelines, that is something that's covered, for patients, all patients in the risk category. And, our ambitions, this lung test is our first. It's a really unaddressed need. And we're, thrilled to be working to, make sure that the screening process for those patients who have risk of lung cancer, have high risk of lung cancer, this just becomes routine. But even for other cancers, and our technology applies to, we've shown liver cancer, we've shown ovarian cancer, we've even shown kind of detection of, multitude of cancers. And we really see a future where everyone has annual screening, and that cancer is not this, diagnosis that means your life changes dramatically forever and you may not survive it. The cancer really is something that can be addressed early, that can be cured, that can be operated, that, is something that, you want to find, and you want to find it as soon as possible.
Yeah, and through the OSF Cancer Institute and the Breakthrough Treatment Center, that's absolutely the focus. Find it early, treat it early. So right now it's risk-based where we're testing because, personally, I've had a couple of friends that they They got diagnosed with lung cancer and they never previously were a smoker. And so if you could have a test like this for everybody, to your point of getting it more broadly screened to catch that, because I'm sure when they heard that news, they had to be like, what do you mean lung cancer? I never, and so, secondhand smoke and those kind of things that we don't know nearly enough about probably.
Well, there's an old saying in medicine, never say never, never say always. So not every lung cancer patient has a smoking history. The majority do, but not every. But up to this point, screening tests, you don't want to cause harm. So the screening test has to be pretty specific and not create a lot of false positives and a bunch of procedures that aren't necessary. So we have to be a little bit careful with the application. But as we drive this technology that Susan and companies like hers are working on, that becomes less and less of a problem because it's a blood test. It's not a procedure with a potential adverse outcome. It's a blood test to screen. So as this technology advances, I think we're going to get much better at screening a broader population.
So go ahead.
I mean, as we work today to expand, the access of this test and really demonstrate its performance in the intended use population, but also, we're looking at what other populations would benefit from it. We do want to make this available to as many people who would benefit from it. And like the good doctor says, I mean, we don't want to cause harm. We just want to give a first look of awareness, awareness of you should, have the next step done. And I think in that way, and especially at kind of the cost structure that we've created this test, going down, getting a reimbursement path to make sure it's covered under screening guidelines and eventually covered by the FDA, we really think that this is dramatically going to change people's lives. And it is unfortunate that people who've never smoked get lung cancer. We care about that too. So we're absolutely looking into populations who would be at risk even if they hadn't smoked.
So OSF HealthCare has just started offering this on a limited basis right now with the goal of having it ministry-wide later this year. What's some of the early conversation that you are hearing from the provider perspective, either from your fellow providers or from patients? Are you getting any feedback yet?
Well, having another option that is such a low burden option is very favorable. And so people are excited about having this option, but we have to build the processes, build the awareness to Susan's point. There's a lot of things that go on behind the scenes to make this happen. But I'll never forget about 10 years ago when Sister Diane Marie said, we don't want to be transformed, we want to transform healthcare. And this is all part of that. Being on that cutting edge, bringing this technology to OSF, our oncology service line under Ryan Luganville's leadership is really pushing, for us to bring this technology to OSF because it is the latest and the best technology. So when our doctors learn about it, they get excited about it. Because the data is pretty impressive, and the technology is pretty impressive. So I think patients will buy into it over the course of time. That always takes time for awareness and people to get comfortable with things. But we're starting to roll it out now at a few pilot sites, and then we will expand it once we get the processes built for a successful expansion.
Okay. I will wrap up with a final question to both of you. What excites you most about this work and what lies ahead?
Well, for me, it's patient outcomes. I've had a number of patients over my career that were diagnosed at a stage that was either difficult to cure or was not curable. And lung cancer especially is very amenable to early detection. I mean, the data is absolutely clear that early detection is the key to survival in lung cancer. So that's what excites me, is I think the patients will really benefit from this.
Absolutely. And I mentioned that I come from a long line of doctors. I saw my father practice every day. He became an OBGYN because his mother died during childbirth, and he really had a passion towards helping people and helping patients. And I went down the technology route. Now I'm back to where I think, the work that we do can make such a difference. And starting with lung cancer, and really addressing a population that the 10-year survival rates, when caught early, are really excellent. And so the opportunity to make a difference and impact people's lives. And I have to say, I had the, pleasure of visiting the OSF New Cancer Center. And it's humbling. It's humbling to see how much focus there is on the patient, on their experience, on their outcome. And we're thrilled to partner with you. So our aspiration would be to enable you to provide the best care for these patients and the best outcomes for cancer.
We're just getting started.
And I was just going to say, yeah, a lot to come, and I'll bring you all back in here maybe a year from now. We'll see where we're at. And it'll be a great follow-up conversation because I expect lots of great things too. Susan Tousi, Dr. Mark Meeker, thank you both for joining us.
You're welcome.
And thank you for joining us for this edition of OSF HealthCare Accelerated.